So today we are going to talk about deviated nasal septum. So before that, let's just start with nasal septum. So nasal septum is formed of three parts: our columnar septum, our membranous septum, and our septum proper. Alright, columnar septum is basically lined by alar cartilage on the inside and it has skin on the outside. Alright, membranous septum is lined just by skin. So if you see, this columnar septum and the membranous septum are the movable parts. Alright, and then we have septum proper. The septum proper is made up of cartilage plus bones. Okay, so we have the septal cartilage and two major bones, perpendicular plate of ethmoid and vomer, and there are some accessory bones like rostrum of sphenoid, crest of maxilla, crest of palatine bone, nasal spine of frontal bone, and crest of nasal bone. Alright, and then we have Little's area. So in Little's area, the vessels anastomose over here, okay, and it is in the interior inferior part, okay, and it is the most common cause of epistaxis. So now we'll come to deviated nasal septum. Okay, deviated nasal septum, as the name suggests, the nasal septum is deviated towards either of the side. So what are the causes? We'll see first developmental error. So let's say our septum, okay, and our hard palate, they grow together, that is, they grow simultaneously. Okay, so if in case now this hard palate becomes high arched, so there won't be enough space for the septum to grow, so it is going to deviate, and this is going to lead to deviated nasal septum. All right, so even in people who have adenoids, right, what happens is that they breathe by mouth. Okay, so they are called as mouth breathers. Now in them also the palate is going to become high arched, and then this will again lead to DNS. Then we have trauma. So in trauma, what happens is that any kind of lateral blow, so here we have our septal cartilage and here we have our vomer, so this is going to displace the septal cartilage from the vomer. Okay, even during birth. Okay, so basically there is pressure on this and this is again dislocated. And then there are racial factors, not that important. Hereditary factors, we see that if the parent has, the child also most probably will have. Now we have types. Okay, we have anterior dislocation, we have C-shaped, we have S-shaped, we have spur and a thickening. So in anterior dislocation, as you see, it is just dislocated. Okay, there's only dislocation either towards the right or the left side. In C-shaped, the septum is in the form of a C. Okay, and here you will see compensation hypertrophy of the turbinates. Alright, so in compensation hypertrophy of the turbinates, these turbinates are going to grow more on the side in which there is more space. Okay, and this will lead to nasal obstruction. And then in S-shaped, it is shaped like a S, and if you see, there will be bilateral nasal obstruction here. Okay, and in spur, here a shelf-like projection comes and it impinges on the lateral wall. Okay, and this is going to lead to headache. Then we have thickening. Thickening is basically due to hematoma. Okay, here just the cartilage is thickened. Alright. So, and then we'll come to our clinical features. Mostly you will see males presenting more than females, and the most common symptom is going to be nasal obstruction. Alright, so nasal obstruction, because on one side there will be hypertrophy of the turbinates and other side there is very less space. Okay, So this will lead to nasal obstruction. It can be vestibular, it can be in the nasal valve area, it can be in the attic region, it can be in the choanal region. Choana is where the nasopharynx starts. Alright, or it can be hypertrophy of these turbinates. So we do a Cottle's test in which the person's cheek, he pulls it laterally, okay. So, and then if it is positive, okay, the airway is going to improve, okay. See, you see this nasal valve. So if you are pulling it, the person will have more space to breathe and he can breathe better. So it shows that it is positive, means there is problem in the nasal valve area. All right, next form is headache, okay. So what happens in headache is that if a spur impinges on the lateral wall, there are nerves and vessels which are connected also to the meninges. Okay, so any pressure on this will also affect the meninges and this will lead to headache. Sinusitis. In sinusitis, if you see, on the lateral wall we have opening of the sinuses, let's say maxillary sinus. So if a spur comes and impinges, again there won't be proper aeration, okay, air won't be able to go in and then this will lead to inflammation or your sinusitis. And then we have epistaxis. So if this is your nose, if the septum is deviated, a lot of air is going to come through this part and this will lead to the mucus becoming dry, and once the mucus becomes dry it will lead to crusting, okay, and the patient will often try to pick his nose with his fingers and this will lead to bleeding, okay, which is called as epistaxis. External deformity, obviously middle ear infection, we have the eustachian tube which connects the middle ear and the nasopharynx. So any problem in the nasopharynx or nose will also lead to middle ear infection, okay. Anosmia is basically this olfactory space is also affected because proper air can't go in and we can't able to smell properly. So treatment, minor degree we don't need any treatment. Medical, you can give decongestants or antihistamines. In surgery we generally go for SMR or septoplasty. 99% of times it is basically septoplasty, okay. Why SMR is not that good? Because first we will do incision on two sides, we'll take out the mucoperichondrial and mucoperiosteal flaps which are there, and then the entire part which is damaged, okay, the cartilage and the bones, we'll take it out and then we will put back the flaps. So what happens is that our nose, it is supported by this cartilage. Now if we take out this cartilage it will lead to depression, okay. So we go for septoplasty. In septoplasty we will give incision on only one side, okay, and then the mucoperiosteal mucoperichondrial flaps are taken off and then we will take off the extra parts and we will fix it back, okay. So here we have the cartilage and our bones are saved, and then there will be no depression. So septoplasty is so much better than SMR. So this was all about deviated nasal septum.